Now to a CBS News Colorado investigation. We have found a little more than a third of Colorado school districts were at risk for measles, mumps, or rubella outbreaks last year due to low immunization rates.
Those rates are better than they were during the pandemic. In the 2021-2022 school year, only 88% of students statewide were vaccinated for MMR. That's according to the CDC. But new state data shows last year the numbers increased to 93%. The CDC says schools need to have at least 95% of students immunized with the MMR vaccine in order to have a lower outbreak risk. This month, there was a measles outbreak in Philadelphia, despite the fact that 93% of students there are vaccinated.
Your investigator, Katie Weiss, taking a look at how some Denver metro area districts working to improve those rates. So, Katie, what were you able to discover?
Well, you guys, while the pandemic really threw a wrench in keeping herd immunity high in school districts, I'm learning that they are getting back on track. School nurses tell me it really comes down to working with individual families to make sure that they have the right resources.
Ready? Go.
Keeping kids healthy is of the highest importance to these school nurses in the Adams 14 school district.
What? We have to wait in between.
That's why they're proud of their high measles, mumps, and rubella immunization rates over the years. And while it might seem some of those illnesses are long gone, making sure enough students are vaccinated to help prevent an outbreak is something school leaders have to work at every day.
It's about educating the family.
School nurse Megan Moyer says higher rates are important to not only protect other students from getting sick, but also the community.
We can protect those that aren't able to get vaccinated yet or have compromised systems such as the elderly, newborns.
In Cherry Creek schools, state data shows the district's MMR vaccination rates have also stayed high over the last few years. Michelle Weintraub is the district's chief health officer.
Our nurse's job is not to parent the children, that's what parents do, but it is to educate and make sure that they have the health access available and to talk to them about their plans, whatever they are, whether their plan is to choose exemption or their plan is to have their child fully immunized or even fully immunized at a different pace, kind of like a catch-up plan. And we've obviously seen some of that since the COVID-19 pandemic because it's very hard to get immunized when you're on a telehealth appointment.
She says the sudden cancellation of an important vaccination clinic hosted by 365 Health last fall also created an obstacle to help more students get immunized. So her team has been working hard to connect families to doctors so they can make the right decisions for their children.
What it does is it can help prevent death. I mean, we know that measles can cause death.
Back in Adams 14,
Almost there.
Nurses like Moyer are building trust with students and parents to make sure their rates don't dip.
Kind of start to build that relationship to get to the place where maybe they could be comfortable on asking us questions and helping them break down some of the barriers.
Now, it's important to remember that MMR vaccines are required by law for students who attend public school. Arapahoe County Health says that decades of research tells us that vaccines are an easy, accessible, and above all else, safe way to drastically reduce the spread of many preventable contagious diseases. And for more information about how to get your child vaccinated and to see vaccination rates in your child's school, I'll be putting those resources on our website later this evening, cbscolorado.com. Guys?
Yeah, we do want to talk a little bit more about this, though, Katie. It's so great to see this trust that they're building, which is really the foundation of all of it, right? So what about the number of vaccine exemptions in Colorado? Have they gone up or down?
Yeah, well, Karen, while Colorado is one of the few states that still allows non-medical exemptions for the MMR vaccine, state data shows that actually the number of students with exemptions has actually slightly decreased since the pandemic, from 3% during 2019 to only 2.5% last year.
We talked a lot about how these numbers compare to pre-pandemic levels. So how do the most recent MMR vaccination rates compare to prior to the pandemic?
Looks like things are starting to even out, Michael. We found that last year's number of a little more than a third of school districts statewide being at risk for an outbreak is actually about the same as vaccination rates were back in the 2017-2018 school year. So that means that a lot of school districts have, while some have a lot of work to do still, many others are really getting back on track.
Yeah, we appreciate your coverage on this. Thank you, Katie.
Well, leaders in Denver are